I want you to imagine something. Every single day you wake up in pain, not a headache, not a sore back from sleeping wrong. Real, deep, relentless pain that doesn't respond to anything and doesn't go away. And you go to doctor after doctor, get test after test. Tropical diseases, cancer, Lyme disease, everything. And every single result comes back clean. And instead of getting answers, you get a shrug. And the words that, if you've ever experienced them, you will never forget. This is just part of being a woman. So you go home. Again. And you keep going. You show up to work. You smile for cameras. You take care of your family, your animals, your responsibilities. You do all of it every day while your body is quietly in crisis. And you start to wonder if maybe they're right. Maybe you're just weak. Maybe this is just how life feels and everyone else is handling it better than you. Bindi Irwin did that for 10 years. 10 years of that exact experience. While being one of the most publicly visible conservationists in the world. While running Australia Zoo. While becoming a wife and a mother. While carrying her father's legacy in front of millions of people who thought they knew exactly who she was. They didn't know this part. Most of them are only finding out now. If you grew up watching Steve Irwin wrestle crocodiles with pure, infectious joy, then Bindi has been part of your world since before she was old enough to know it herself. Born July 24th, 1998 in Queensland, Australia. Named after her father's favorite crocodile and his beloved dog. Bindi Sue Irwin didn't exactly have a conventional childhood. She grew up inside Australia Zoo, homeschooled, surrounded by wildlife, on camera practically from the moment she could walk. By 8 years old, she had her own wildlife documentary series. By 9, she had a daytime Emmy, the youngest performer ever to win that award at the time. At 17, she won Dancing with the Stars in the United States. She's now CEO of Australia Zoo, an Earthshot Prize ambassador alongside her brother Robert, a conservationist, author, and mother to her daughter Grace Warrior, born March 2021 with her husband Chandler Powell. From the outside, Bindi Irwin's life has always looked like the most purposeful, joy-filled story imaginable. A woman born into something extraordinary, who stepped into it fully and made it even bigger. But here's what that picture never showed. Behind every single one of those milestones. The Emmy, the Mirrorball Trophy, the wedding, the birth of her daughter, every zoo appearance, every conservation speech, every camera she smiled into. Bindi was in pain. Constant. Unexplained. Dismissed. Pain. She has described it herself as indescribable, inescapable pain. Not the kind you manage with rest and a couple of painkillers. The kind that is simply always there, underneath everything, threading itself through every ordinary moment of your day. Getting out of bed. Sitting through meetings. Standing in front of a camera and pretending everything is fine. She was tested for everything. Lyme disease. Tropical diseases. Cancer. Every blood panel, every scan, every specialist that the next referral sent her to. Every single result came back with nothing. No explanation. No name for what was happening. Just more waiting and more pain with no answer attached to it. And the medical response, repeatedly, was some version of the same sentence. That this was normal. That women experience pain. That it was something to manage, not something to investigate. She was a teenager when this started. She absorbed what the doctors told her the way teenagers absorb things. As truth. She began to believe she was weak. She has spoken openly about feeling deeply insecure and trapped in her own body during those years. About carrying shame around something that was never her fault and never in her head. And here's what makes that particularly difficult to sit with. Bindi Irwin is not someone who could take a quiet sick day and disappear into her own private struggle. This is a woman with a public-facing life that runs on visibility and presence. The zoo needed her. The cameras needed her. The conservation work? The interviews? The responsibilities that come with being the face of something that meant everything to her father. None of that paused because her body was in crisis. So she kept going. She kept showing up. She kept being the version of herself the world expected. For 10 years. In March 2023, Bindi posted on Instagram with something she had been waiting a decade to be able to say. She had a diagnosis. Endometriosis. If you're not familiar with the condition, endometriosis is where tissue similar to the lining of the uterus grows outside it, attaching to surrounding organs and causing severe, chronic pain. The World Health Organization estimates approximately 190 million women worldwide are affected, 9 million in the United States alone, and the average time between a woman's first symptoms and her eventual diagnosis, 7 to 10 years. 7 to 10 years, which is almost exactly how long Bindi had been suffering before anyone found the answer. That number is not a coincidence. It's a pattern. It is one of the most consistent and damaging failures in women's healthcare. A condition affecting nearly 200 million people, routinely dismissed as period pain, and taking the better part of a decade to diagnose in the average patient. Her first surgery was performed by Dr. Tamer Sekin at Lenox Hill Hospital in New York. And what they found when they went in was not a minor case quietly sitting in the background. They removed 34 endometriosis lesions in that first procedure alone. Bindi was also deliberate about something that most public figures would have glossed over. She didn't just share the diagnosis. She explained the difference between ablation and excision surgery. Ablation, the more common approach, burns lesions from the surface. Excision cuts them out entirely, roots included. It's more complex, more demanding, but for many patients, it produces significantly better long-term outcomes. Her mother, Terry, made a point of noting this in the comments, urging women who were seeking treatment to specifically ask about excision surgeons. That one detail, shared publicly by a woman with Bindi's reach, has the potential to change outcomes for women who might otherwise have accepted a less effective treatment without knowing the difference existed. The 2023 surgery was not the end of the story. While continuing her treatment, Bindi required emergency surgery in the United States. During that procedure, doctors discovered additional lesions that hadn't been reached previously. They also found that her appendix needed to be removed. And on top of that, she needed a hernia repair from childbirth. One emergency surgery. Appendectomy. Hernia repair. More lesions removed. All at once. Her husband, Chandler, in a statement that felt like it came from a place of genuine exhaustion and relief, called her the strongest person he knows. The most recent update came in March 2026, during Endometriosis Awareness Month. In total, over 50 endometriosis lesions have been removed from her body across her surgeries, plus a chocolate cyst that was physically adhering her ovary to the wall of her body. 50 lesions. An ovary stuck to her body wall. An appendectomy. A hernia repair. And during all of it, she was feeding crocodiles, running board meetings, filming television, raising her daughter, being photographed, doing the work. The gap between what the world was seeing and what was actually happening inside her body is genuinely staggering when you lay it out that plainly. Bindi Irwin did not share this story and then move on. She partnered with the Endometriosis Foundation of America. She was honored at their Blossom Ball in May 2024 with the Blossom Award. She speaks regularly about the condition, about the failures in diagnosis, about the specific surgical approaches that actually work, and about what women can do when the system keeps dismissing them. In her March 2026 Instagram post, she wrote directly to women who are still searching for answers. If you're in pain, my heart breaks for you. I believe you. Please find answers. And don't give up on yourself. 3 words in that message carry the most weight. I believe you. Because for women who have spent years being told their pain is an inconvenience rather than a symptom, being told by someone with Bindi's platform that they are believed is not a small thing. It is, for a lot of people, the first time anyone with any credibility has said it to them. The post received over 3,600 comments, women from everywhere sharing the same experience. Dismissed, undiagnosed, told to push through. Her brother Robert spoke to E! News about the broader issue, noting that women's health has been historically underfunded, under-researched, and under-discussed, and that it takes advocates. Men and women both. To change that. Dr. Kathy Huang, director of NYU Langone Health's Endometriosis Center, has said it plainly. The most important takeaway is that pain is not normal. Bindi is now one of the loudest, most credible voices carrying that message,